I've been in that field for 30 years. I started transplanting patients with Parkinson's disease and Huntington's disease with fetal neurons at the beginning of the 90s. It appeared very rapidly that regenerative medicine is the way to actually rebuild organs that are affected by disease. That it's you can protect the cells by treatment. You can avoid the consequences of a loss by treatments. But you can't replace cells that are lost without introducing cells, and at least for organs that you can't transplant by themselves. And so I think that regenerative medicine was blocked at one point in the 90s because we didn't have access to cells that we could actually work out in the lab, so that we can indeed think of applying it without all the burden of accessing cells that were rare, difficult to access, and so on, like fetal neurons. And so with the pluripotent stem cells, it was a fantastic step forward, because indeed we had that holy grail of cells that we could work on in the labs and differentiate into whatever we wanted. And so I think that what is extremely exciting is that we see the progression between an idea that was just completely infeasible at the beginning of my career and something which is now a question for industry. And that makes a tremendous change, because when you look at diseases, ISTEM is an institute dedicated to genetic diseases. And when you look at diseases like that, you don't look at them thinking, okay, I can't do anything. You look at them saying, okay, maybe today I cannot do yet, but I know that tomorrow we will have ways to do it. And when I did my medical degree, and that was 40 years ago, my colleagues, when I chose to become a neurologist with a specificity for genetic diseases, they considered that the only thing I could do was diagnosis. And so they called me the stamp collector, because I thought that that was the only thing I could do. And so 10 years later, I was doing fetal neural transplants. So, it was quite an answer to them. But indeed, the philosophy of the MDs at that moment was that you had diseases for which you can't even think about doing something, which is not at all the case now. And indeed, the young students that we have at this moment, the residents and so on, we teach them to think about a disease, thinking, okay, even if I don't know what to do now, I will know eventually.